Good morning. I want to welcome you to our press briefing with updates on COVID-19. As we continue to lose citizens in our community, I would ask that we pause now for a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor?
Thank you, Chief. I want to remind the public that every Wednesday we have a meeting of a task force. We hear from representatives of Phoebe Putney, we hear from Dr. Ruiz or someone else from the Department of Public Health. We hear from representatives of the Chamber. Sometimes President Fedrick and Dr. Parker update us on Albany State and Albany Tech. We hear from representatives of law enforcement. Mr. Dyer updates us on what's going on with the school system. We are continuing to work through this pandemic, and most all indications are positive. But again, I want to say what I said 2 weeks ago. We cannot be complacent. I want to just briefly bring some issues to the forefront. Dr. Ruiz, when he gave a presentation this week, he told us that according to the Department of Public Health's website, Dougherty County's positivity rate in the last reporting period was 2.9%. He said that is lowest in the 14-county district, and that's Southwest Georgia. That is extremely, extremely encouraging. But I think we as a community need to be aware that the numbers of infections are increasing in 38 states. Some countries in Europe, Britain and Spain, are going into lockdown. There are some countries in Eastern Europe which for the first time are going into lockdown. This pandemic continues to be with us. And some numbers here from Dougherty County. Dr. Ruiz explained that there are some inconsistencies with the numbers we give because what we rely upon is the testing figures from various locations in Dougherty County, primarily the hospital, the Department of Public Health, Albany Internal Medicine, and Albany Area Primary Health Care. Sometimes we get numbers from other locations, but those are the four sources we typically get. The numbers we're giving you include people who are tested here in Dougherty County. Dr. Ruiz explained to us that the Department of Public Health utilizes only individuals who are residents of Dougherty County. And that means if you have a child who is on campus at Milledgeville or Valdosta or Statesboro or Athens or Fort Valley, that number is coming back to Albany according to the Department of Public Health website, but it's not in the numbers we're giving you. And likewise, the numbers we're giving you include people from contiguous counties who are coming into Albany and being tested. Now, those figures, the 2.9%, likewise positive. Dr. Ruiz advised us that during that reporting period, we were having infection rate of only 72 per 100,000 residents. And we know again that the threshold for the mask mandate is 100 infections per 100,000 residents. I'm thinking that there is a good possibility we're fixing to go in the other direction, and here's why I want to tell you that. The representatives of Phoebe Putney told us that last week the positivity rate was 4.7%. That compares to a positivity rate of 4.3% the previous week. Now, there are always going to be fluctuations from the different sources, but the Department of Public Health told us that their positivity rate was 5%, and that was up from 3.5% the previous week. Probably more important than any of these figures is for the first time is the lowest since June. But on the day of the report, Mr. Austin informed us that the number of COVID patients had increased to 34. Now, these are figures. I think what we're seeing is what was referred to as maybe a slight uptick. But that is why we have to continue to be vigilant. The numbers, the encouraging numbers I've discussed are a testament to the success of the public health measures and the precautions which have been taken. Again, I want to encourage everybody to wear masks, maintain social distance. You know, I continue to be concerned about folks that say, well, the mask ordinance isn't in place. Whether or not the mask ordinance is in place, it's the right thing to do. And I want to assure you that if we, the numbers increase to over the threshold, the mask ordinance will be enforced. We continue to live in an altered state. ASU is aggressively testing students on campus. ASU this week is having a virtual homecoming. That is a responsible concession, and I want to commend President Frederick and the administration at ASU for making that decision, which many alumni are unhappy about. Albany Tech continues to have classes mostly remotely. Most students in the Dougherty County school system are taking virtual classes. The churches who are meeting typically have half the attendance and everyone's wearing a mask. This is a fight that's not over. But also, in closing, I just want to mention our small local businesses continue to struggle. So again, we would encourage you, something we hadn't mentioned in some time, but it remains true. Please patronize restaurants and local businesses as they struggle through this time. Thank you for your attention, and thank you for participating in this fight. Thank you. Thank you.
Dougherty County Commission Chair, Mr. Christopher Cohilas. Sure.
Morning. Thank you, Chief. Thank you, Mayor. Appreciate this opportunity. I'm not going to take a long time today, but I'm going to talk about some of the data that we're currently seeing. And a lot of hard work has been put in to make sure that we have access to data here in Dougherty County that, frankly, is not accessible in many other communities around the state, and frankly, provides a more accurate, real-time assessment of where we are day to day versus the information that we get back from the state. And that's not a criticism of the state, but the state gets its numbers and then it collates it, that it returns it back to the community, returns it back to the public. We are in a very fortunate position as a result of unfortunate circumstances. Because at the beginning of this, we had such an onslaught of the virus. We literally had to learn how to collate our information and had to work very, very quickly in order to be able to gather information from as many sources as possible. The mayor did a great job of pointing out the strength of our task force. and how we have worked to get information from every testing site within the community. We have testing site information that comes in from Phoebe Putney. We have testing site information that comes in from private healthcare providers. We have testing information that comes from the Department of Public Health. We're now getting testing information from Albany State University, and that's very, very important. We literally take that information, we collate it within the Emergency Management Agency through cooperation between the county and the city. And I have to say, the partnership between the county and the city on this project in terms of emergency management has been critical to our community in being able to leverage our resources that are not only the human resources that we have, but also the collective intelligence and experience of our healthcare professionals, our public safety folks, everyone that works within that sphere working towards one goal. And that has provided us with a very accurate picture. And it's interesting, we get contacted by other jurisdictions and asking us, how is it that y'all gather all of this information? What are your strategies? How do y'all form the strategies? And we're able to share that so that hopefully other communities don't have to experience what we did at the beginning of this pandemic. So I want to turn for a second and I want to talk about some of the data. If you look at the chart that we have up on the screen at this time, we are now, in terms of the last time that we have collated the data, as of October 19th of 2020, we are at our lowest point since the beginning. Waiters and waitresses on ways to conduct business and making sure that people are safe. And we're doing a very good job. And I do agree with the mayor. It is very important that we don't become complacent. That doesn't mean that we have to lock ourselves away in the ways that we were in March and April of this year when we were on virtually a complete lockdown. But we have all learned safe and reasonable ways to go about our daily lives in order to mitigate the risk that we will either contract the virus or spread the virus to other folks. We've also learned strategies on how to best mitigate and protect those people that are most vulnerable to the virus. We're all learning new ways of connecting with each other that don't involve that close face-to-face contact and within large groups. We're utilizing things such as Zoom. We're utilizing FaceTime. We're leveraging technology in ways that are far better than we ever did before. And we have to continue to think that way so that we can maintain connection with each other. And I've said this from the very beginning. We're human creatures. We crave connection. We crave the ability to congregate and to speak with each other. And it's very important. And frankly, it's vitally important to the mental health of this community. And so I've been encouraged to see the large number of healthcare providers that are offering web opportunities or Zoom conferences or telehealth opportunities so that people can get either the mental health or the physical care and physical assessments that they need for their circumstances. It is very important. If you have underlying conditions or other health conditions, that you continue to aggressively seek treatment for those conditions, not just locking yourself away at home and not connecting with other people. There are safe ways to do that. There are many great ways to accomplish many of the things that we used to do back in February and January that, frankly, I didn't know about. I'm fascinated with the number of professional shoppers that we have in this community, the fact that you can literally order groceries off of an app, that we have folks that can efficiently go and buy groceries and you can order them from your phone and they'll deliver them while wearing a mask to your house. Those are the types of things that we have to continue to embrace in our community as we struggle to find connection at the same time that we continue to battle a marathon. Because this is not a sprint, it's a marathon. And we have demonstrated, as we did in 2017 with the disasters, with the tornadoes and the hurricane force winds and Hurricane Michael of 18, we have in Dougherty County demonstrated again and again that we are Albany strong. Thank you.
Thank you, Mr. Chairman, for your remarks today. We will now hear from our representative from Phoebe Putney Memorial Hospital. We have the Chief Medical Officer of Phoebe Putney, Dr. Stephen Kitchen.
Thanks, Chief. Let me see if I can. When I provided the update from Phoebe Putney two weeks ago, I was happy to have the opportunity to share with you that the numbers of hospitalized patients we were seeing across our health system had declined significantly over the preceding few weeks. And what I'm going to tell you today is there's really been no significant change that we have observed over the last 2 weeks. We hit a watermark moment, like I said, about 2 weeks ago, where for the first time since the local impact of the COVID-19 pandemic hit Albany in our health region, that our number of hospitalized patients fell below 30 for the first time since March. And so we hit that watermark low point about 2 weeks ago, and we had about 27, 28 patients hospitalized at that time. Today, we have a total of 35. 33 of those are at Phoebe Putney here in Albany. Most of those are at the North Campus. And there are currently 2 patients hospitalized at Phoebe Sumter in Americus. I think what we can expect at this point, there are going to be some fluctuations in those numbers day to day and week to week. But I don't think at this time it's indicative of any significant change in that trend that we're seeing at this point. Obviously, there are regions across the country that are seeing significant increases in the number of patients that they see. But again, I think what we're seeing locally and regionally is a relatively stable situation at this time. And I know, and this is just simply to reiterate the comments that you've heard from our mayor and our county chairman of our county commission as well. But I think what we have learned as a community is there's those basic public health steps that if we all embrace those collectively as a community, we can largely mitigate the impact of this. And again, those are those basic steps that we've spoken about on numerous occasions before. Masking, I cannot overstate, for this particular virus, masking is extremely effective in reducing the chances of transmission. That doesn't occur with every respiratory virus that we see, but for this particular virus, masking is so effective. And I think regardless of whether there's an ordinance in place, I think there's those prudent, responsible steps that we all have a collective responsibility as a community to practice. So I would put masking first and foremost there. Certainly the social and physical distancing that we've talked about before, again, is very, very effective as a public health measure. good hand washing and hand hygiene, again, is very effective, and particularly with the flu season upon us, can also have a very, very marked impact on flu as well. And lastly, the fourth step is avoid gathering in large groups. And I think we all we all appreciate the impact that this has had. And as Chairman Kohelas has said, it's been a difficult adjustment because we're social creatures at heart. But I think what we have learned is this. Although it may be what we would refer to as a new state of normalcy at this point, the truth of the matter is we can go about our lives and we can continue with both social and business functions to do those essential functions that we need, but it's going to be within the context of these common sense public health measures that we have spoken about before. We had seen a significant decline in the number of COVID positive patients that were requiring ICU care. And again, I think we'll see some fluctuations in that, but it had been, we were down to 3 or 4, but by today that's back up to 10. So I guess the point that I'm trying to make is, although we I think have come together and have had a significant impact on the prevalence of this virus in our community, I do want to state the obvious that this virus, unfortunately, has the potential to cause very, very serious illness and death. So, unfortunately, I will share with you that the total number of deaths that we have experienced in the Phoebe Putney Health System hit 200, with 158 of those at Phoebe Putney in Albany and 42 at Phoebe Sumter in Americus. And although the vast majority of these deaths occurred very early in the pandemic, being in March and in April, again, I want to emphasize the fact that it has the potential to be a very, very serious illness that can cause death. Lastly, I think our understanding of this illness, the various medical manifestations and how to effectively treat it continues to evolve at this point. And I think what the ultimate effect of that is, we are becoming more effective in how we manage this illness, and that certainly has the favorable effect of decreasing mortality rate as we go along. I think there are some new things that are just beginning to come out that there's probably a genetic basis that has some impact on people's susceptibility to develop serious illness and death. So I think that will continue to evolve. And lastly, I do think the best hope on the horizon ultimately is going to lie with the development of a vaccine against COVID-19. It looks like there are probably 3 very, very promising vaccines that are on the forefront at this point. But again, it always requires a degree of due diligence to make sure that any vaccine has been proven to be safe and effective. So I'll leave you with that today, and I certainly appreciate your time and attention today.
Thank you, Dr. Kitchen, for your remarks today. We will now move to public health, and we will hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz.
Thank you, Chief. Those of us in public health want to express our gratitude to everyone who has been following the guidance that helps us to reduce the transmission of COVID-19. We're out and about sometimes in the community, and we see folks wearing masks and staying 6 feet apart, and we know that most everybody is really doing a good job. We appreciate it, and our hope is that everyone would get on board and then follow the guidance to help us keep our community safe. One of our jobs in public health is to investigate each and every case of COVID-19. And that's not just in Dougherty County and not just in our district, but statewide. So once we learn of a case that's new, we contact people, usually by telephone, and we investigate. And part of that investigation leads us to ask questions about where the individual has been before they tested positive for COVID-19. And in a lot of situations, we find some common denominators. Over and over again, we learn about cases that were transmitted where masks were not worn, where social distancing was not practiced. That's not always the case. Sometimes we don't really know where a person gets the infection. But we continue to see people who go to work and school and other social events when they know that they have symptoms consistent with COVID. So we're asking everyone to practice social distancing, wear your mask, and when you're sick, please stay home and consult your medical provider and let the provider advise you on whether you need to stay home or get tested or be evaluated for possible COVID. So symptoms, let me back up just a minute. I want to say that I agree with many things that have been said today, that we have enjoyed some relatively good numbers here in Dougherty County, and we want to keep it that way. And this time of year is just a fact that many of us like to get out and socialize. We like to participate in social functions like sports activities. Some of us are participants, some are spectators. There are fall festivals around that we have an opportunity to go to. And then in just 8 days, Halloween will be here. And we all know that Halloween involves many activities that are kind of contrary to what we're asking people to do nowadays. So the rule of thumb generally is that if you can participate in these kind of activities and maintain social distancing and keep your hands clean, wear a mask, it very well may be safe to do so. But if you're considering whether to participate in one of these activities, such as Halloween or a fall festival or sporting event, just ask yourself, is it going to be safe? Can I keep myself safe and keep others safe? And if the answer is no, then please think twice about going forward with that activity. Testing is something I want to talk about. Testing is still available. Here in Dougherty County, it's available in a variety of places. Public Health is offering testing 3 to 4 times a week here at the Forestry Commission building at the south end of Slappy. And it's easy to make an appointment. There are 2 easy ways. You can make a phone call, 229-352-6567, and set up an appointment. Operators are there Monday through Saturday. Another very easy way is to go online. If you go online, you can see the available appointments, and you can also see locations that are outside of Dougherty County. And sometimes that may actually fit into your schedule better. So you can pick your time and your location. You can do that 24 hours a day online. And the place to go is covid19.dph.ga, and it's easy to do. It takes less than 5 minutes to do that. The turnaround time nowadays is good. We have the results generally in about 24 hours, and you can actually go online and see your own results as quickly as we can see it. And then I want to talk for just a second about flu shots. Many people have made the wise choice this year. They've gone out and they've already gotten their flu shot. I've had mine, and it's a good idea to get that flu shot right now if you haven't had it. There are many places around the town and county where you can go and get a flu shot. It doesn't have to be at Public Health, but we would invite you to consider getting your flu shot at the health department. Generally, we tell people you don't need an appointment, just go ahead and get the shot. But with the COVID pandemic being like it is, we would prefer that you call the health department but before you come, just to make sure that it's a good time to get that shot. So if you get a flu shot now, it helps to prevent the flu. And one of the things we worry about is people who might get influenza and COVID-19 at the same time. That's a pretty deadly combination. We don't have the COVID vaccine ready yet, but we do have the influenza vaccine. So we can take care of the first part of that problem. And another advantage in everyone getting the flu shot early this year is we would like to have that activity behind us so that when the COVID-19 vaccine is available, we can dedicate all of our resources toward the endeavor of vaccinating the community for COVID. And in closing, I want to say that if we could all follow the guidance to reduce COVID transmission, what we may be doing is actually saving the life of a neighbor, a colleague, or ourselves, or someone that we love. We appreciate your cooperation.
Thank you, Dr. Ruiz. We will now hear updates from Dougherty County Coroner, Mr. Michael Fowler. Mr. Coroner.
Good morning. I want to say, Dr. Ruiz, I got my flu shot. Went on and got it. I've heard someone call my office and ask me what you think about the flu shot. I would encourage you to get the flu shot because that will save life. And EMS trying to determine whether you had the flu, or whether you have the virus, that's going to be very difficult at our scene. At this time, we just have 189 deaths. I know there's still too many deaths, 189. We have 2 more deaths since the last time I was up here. I want to encourage you, yes, the death rate have slowed down tremendously. I mean, it just, have you heard the different numbers that have been given this morning? Everyone's saying the numbers are declining. I know our chairman said earlier, this was with the hot spot back in March and April. This was a hot spot. I would love for, since Dougherty County was a hot spot and we came up with ways and ideas and trying to prevent this spread in our community, I would love for to get to the point they look at Dougherty County not as the hot spot, but as the spot that don't have no death, at the spot that don't have no one in the hospital. But how we gonna get to that point is all of us gotta get on the same page. Whether you should wear a mask, I think everyone should wear a mask. Now that I know that you're going to be able to go into churches now, you're able to go to games, you're able to go to funerals and things now. The way to wear the mask is not just wearing it on your chin or wearing it around your neck. You got to have it on your mouth and nose. When you go to the game, go in churches, we got to keep this virus down. That's what I might plead with you. Wear a mask. If you're going to be within 6 feet of someone, wear a mask. It do not hurt. When you're riding around in the car, you can take the mask off. You by yourself in your car, you take the mask off, that's fine. But when you get out in the public, you need to wear a mask. Many times I go to the different games and many funerals that I go to, so many individuals don't wear a mask. You don't know who might be coming to the funeral from out of town with the virus. On the safe line, wear a mask. I want Dougherty County to get to the point they said next month when we come in here, or the next time we have a meeting, that we had no more death and the number in the hospital is declining. I wanted to get to 0 in the hospital. But we got to all band together and can make this happen. Dougherty County was the hot spot, but we can be the coolest spot in Georgia if all of us come together. Thank you.
Thank you, Mr. Fowler. We will pause now for questions today. Okay. Well, we will ask you to join us for our next press briefing, scheduled now for November 6th at 10 a.m. We will continue to ask you to mask up Albany, mask up Dougherty County. Thank you and have a great day.